Bismillahirrahmanirrahim and Assalamu alaikum. Welcome to a new video about typhoid fever. Before we started, please subscribe our channel and follow for the further medical videos. Let's get started. Typhoid fever. Typhoid fever is bacterial infection which is caused by bacterium Salmonella typhi. It is a serious disease that can cause a high-grade fever, headache, weakness, stomach pain, and sometimes in skin rashes. Typhoid fever is typically spread to contaminated food or water, and it's more common in area with the poor sanitation of water and unhygiene food. Signs and symptoms of typhoid fever, which include high-grade fever, a headache, weakness and fatigue, muscle aches, abdominal pain, and diarrhea or constipation. This may include the loss of appetite, enlarged of spleen and liver, and confusion. These symptoms can develop gradually over several days or 2 weeks or after exposure to the bacteria. The incubation period of typhoid fever is the time between one person is exposed to the bacteria and when they start to experience symptoms. It's typically range from the 6 to 30 days. Within average, around 10 to 14 days. During this time, the bacteria multiply and spread throughout the body. It is important that some people can be a carrier of bacteria without showing any symptoms and can unknowingly spread the infection to others. These carriers can continue to share the bacteria in other species for weeks to years after their initial infection, making good hygiene practices and vaccination important to preventing the spread of typhoid fever. Diagnosis of typhoid fever. The diagnosis of typhoid fever typically involves combination of clinical evaluation or examination, laboratory test, and also a medical history. Diagnosis for the typhoid fever, which test a blood sample is taken and sent to the laboratory for analysis. This can help identify the presence of Salmonella typhi bacterium or antibodies to the bacteria. The second one is the diagnosis for the typhoid fever is a stool culture. A stool sample is collected and sent to the laboratory for analysis. This can help identify the presence of bacteria in stool. And the fourth one is bone marrow culture. It's a severe causes of typhoid fever. A bone marrow culture may be necessary to confirm the diagnosis. And 5, Vidal test, which is have two antigens, which use two antigens for the typhoid fever, which is TO and TH. This is a blood test that measures the level of antibodies against the Salmonella typhi bacteria. However, this test is not always reliable and can give false positive or false negative. Typhoid fever is a typically involved combination of antibiotics and supportive care to manage symptoms and prevent complication. Here is some common methods used in treat for the typhoid fever. Antibiotics. Antibiotics is include the for the severity or depending on the severity of the infection, which is used the ciprofloxacin, azithromycin, and ceftriaxone. And the second one is a fluid and electrolytes. A typhoid fever can cause dehydration and electrolytes imbalances. So it's important to drink plenty of fluids and replenish electrolytes through a oral rehydration solution for the intravenous fluids. For the fever management, we also offer the counter medication like paracetamol, Panadol to reduce a fever, to relieve a pain. Nutritional support, a balanced diet and nutrition supplement can help support the immune system and promote healing. Fire also have serious complication. It's important to seek medical attention promptly. If you suspect you have a typhoid fever, is untreated causes can lead to the serious complications such as intestinal perforation, bleeding, and sepsis. Thanks for watching.